I'm Lori Marie Pashota. I'm the Executive Director of the Mental Health Association of Rhode Island. We are a small, nonprofit consumer advocacy organization. Rhode Island has a problem. It's a big problem. We do not have enough in-network, outpatient, mental and behavioral health professionals to see all the Rhode Islanders who need care. This is not new. This predates the pandemic, and I can tell you firsthand, we've had shortages for a long time. In 2018, I was having difficulty coping with a clinical depression. I have a history of sometimes life-threatening clinical depression. I called around to a bunch of therapists in my insurance network. I found two that seemed like I would click with them and they had the area of expertise that I needed. I went on wait lists for both of them. One of them bumped me to the top of her list given my history, so I only had to wait a month. And the second one called me 3 months later to say she had an opening finally. I can tell you as a patient, it is demoralizing and dangerous to reach out for help and to be told that you have to wait for it. Something really needs to change in Rhode Island. We know that OHIC is conducting a rate review, and we're grateful for the General Assembly for approving that and funding that, but patients cannot wait. Something needs to change now. This bill affects only commercial insurers. It does not cost the state of Rhode Island a dime. And it may even help to lower premiums in the long term, because if we increase access to care at the outpatient level, we can often prevent crises from developing and overutilizing emergency departments and hospitalization, which are very expensive levels of care. Our system of care is broken, Rhode Islanders are suffering, and I know that we're going against powerful interests in our state, but I would ask that this General Assembly give patients like me at least equal power in this dynamic. Thank you very much.
Thank you. Are there any questions? Seeing none?